choose a front-loaded or an integrated CRNA program. But my hot take is that this, at the end of the day, doesn't really matter. At the end of the day, you're going to get the same case volume, you're going to get very similar clinical hours, and there's pros and cons to both. A pro of an integrated program, integrated meaning that you're taking your didactic classes and you're in clinical at the same time, is that you're exposed to the operating room sooner, you're exposed to the workflow of inductions, and you're just more familiar faster with the OR culture. On the other side of it, you have front-loaded programs where you take most of your classes first and then you do clinical. You are still taking classes while you're in clinical of note, but it's usually more like boards preparation type classes and then writing your DNP project. So I'm in a front-loaded program. I like being in a front-loaded program because I think it's allowed me to be able to focus exclusively just on school. And it's nice that I'm not having to divide my time between choosing to do case prep for my patients the next day and prepping for an exam. Because at the end of the day, if you're in an integrated program, what matters the most is your patient safety. So you should prep for your cases, even if it comes down to case prep versus studying. So I have kind of the benefit of being able to focus exclusively on school and on grades. And then when I start clinical in January, I'll be full-time clinical like 4 or 5 days a week. When it comes down to it, if I got into only one program, I would still go. I would not go to a program because it's integrated versus front-loaded. And I do think that there's also a benefit to being clinical earlier. I have the opportunity to shadow in my front-loaded program. And while I'm shadowing, I'm getting the mechanics of the induction sequence down, my machine checks, I am doing cases. So I'm grateful to have kind of that mix where I am in the OR a few days a month, but I'm also just focusing on school at this time. So at the end of the day, yes, I am glad that I'm in a front-loaded program, but I would go to an integrated program if I got into an integrated school.